It's the highlight of the year for diabetes professionals around the world, providing the very latest cutting-edge advances in diabetes research, prevention, and care. This is the 81st American Diabetes Association Scientific Sessions, and you're watching ADA TV. It's Saturday at the meeting, and we're back for more from the wide world of diabetes science, from the latest technology to leaders in the field. Check back for more content daily at the front page of the meeting platform, on the ADA website, and on YouTube and Twitter. Today, we'll speak to ADA President of Healthcare and Education, Dr. Cynthia Muñoz.
The American Diabetes Association allows professionals and people with diabetes to find mental health providers.
And speak to 2021 Outstanding Educator in Diabetes Award recipient, Dr. Denise Karen Prochownik.
I wanted to develop a preconception counseling program for adolescent girls so we could start preconception counseling early and give it to them often.
We'll also take you all over the world to see some of the very latest technology in the diabetes field, from insulin pumps to artificial pancreases and much more.
Patients will be empowered to take ownership of their healthcare journeys through AI technologies.
First, let's get a rundown of Saturday's highlights with Dr. Donna DeBalia, Chair of the Scientific Sessions Meeting Planning Committee.
Welcome back to the ADA's 81st Scientific Sessions. Today is the second day of our meeting, and as before, we have a packed day. Starting at 8 sharp, a much anticipated symposium on practice-changing trials in heart failure and kidney disease with SGLT2 inhibitors, including the liver and cretins. At 10:15, don't miss the ADA's Presidents for Healthcare and Education address, delivered by Dr. Cynthia Muñoz, whose address will focus on pediatric diabetes and its changing landscape in the COVID-19 era, followed by the Outstanding Educator in Diabetes Award lecture presented by Dr. Denise Karen Prochownik. Early afternoon, we are discussing about social determinants of health in the context of diabetes, approaching diabetes care through a health equity lens. The symposium also includes the Richard Rubin Award lecture delivered this year by Dr. David Marrero. The program commemorates today the 100th anniversary of the discovery of insulin, a landmark achievement in diabetes and medicine as a whole. The session, Insulin at its 100th birthday, will review the major discoveries related to the synthesis, secretion, and action of endogenous insulin, as well as its pharmacological modification and use in the clinic. We end the day with an NIDDK symposium on heterogeneity in diabetes mellitus and how to develop a more stratified medical approach from the bench to bedside. In a parallel session, the Norbert Frankel Award lecture, delivered this year by Dr. Denise Faig, an outstanding clinician scientist who has contributed enormously to the field of diabetes in pregnancy worldwide. So a full day that I hope you will enjoy thoroughly. See you all tomorrow.
Come back tomorrow to hear the highlights from Sunday. Today, we're taking a closer look at the technology providing new options to diabetes patients and clinicians. First to the Netherlands, where Inreda Diabetic has developed the very first integrated, fully closed-loop bihormonal artificial pancreas.
In 2003, I had 10 years diabetes roughly, and it was really a problem for me to have to handle my daily situation. At a certain evening, I was in front of my fridge and I saw the glucagon, and instead of getting me out of trouble, I thought perhaps it's better to use this not to get into trouble. And that's why I decided to make a bihormonal system. After 15 years development, roughly 2.5 years ago, I was at the point that I could wear my own device.
We conducted several studies. We found that the time in range was significantly increased with the artificial pancreas compared to the standard insulin pump therapy. And we also found that the median glucose values were lower with the artificial pancreas.
The Inreda AP We'll give insulin during meals, we'll give glucagon when the glucose levels are decreasing. So during the night, the glucose levels are perfectly controlled, and during the day, they don't have to think about their diabetes.
Be sure to visit our virtual exhibitors. You can connect with them and see all the latest information on the services and products they provide. You can also participate in our Industry Learning Hub and take part in a range of exciting learning opportunities. Up next, we've got an interview with Dr. Cynthia Muñoz, ADA President for Healthcare and Education, where we discuss health equity and mental health. First, though, a visit to Singapore's Institute of Data Science, where researchers are developing an artificial intelligence platform to help primary care teams slow and stop disease progression.
IDS is established in 2016. We aim to develop strategic capabilities in data science analytics. For the Jarvis project, we have been working with our partners from SingHealth to tackle the grand challenge set up by AI Singapore.
Jarvis is a collaboration between a multidisciplinary team of clinicians, data scientists, and health services researchers. And our aim is to use artificial intelligence to support better care for patients with diabetes, hypertension, and hyperlipidemia. If successful, we'll be able to scale this up nationally in Singapore, as well as apply this in other countries and work with partners, use these solutions to help their patients.
We all miss seeing our colleagues, but you don't have to. Check out the networking feature where you can chat with other attendees and even set up a meeting with a group via video, voice, or chat. You can also take part in ADA's chat channel, where you can participate in existing topics or create your own topic and start a conversation. I'm now joined by ADA's President of Healthcare and Education, Dr. Cynthia Muñoz. Thank you so much for being here with us.
Thank you so much for having me.
The health of the nation has been front and center this year. How have you and the ADA been pushing for better health equity, and how has the last year really informed this drive?
This year alone, the American Diabetes Association launched the Health Equity Now platform. This platform serves in part to overcome socioeconomic barriers, and it strives to increase access to research opportunities, devices, medications, so much that is needed for people with diabetes to have optimal care and quality of life.
We've also seen the mental health of the population hit hard, with isolation and the imminent threat of disease having a big effect, especially on those with existing health conditions. So how is the ADA working on the mental health of those living with diabetes today?
The American Diabetes Association is focused and aware of the needs for people with diabetes and their mental health well-being. The American Diabetes Association also has a searchable online mental health provider directory. This allows mental health professionals and people with diabetes to find mental health providers that can understand their unique needs as a person with diabetes and to provide that important mental health support.
Thank you so much, and all the best for the meeting this year.
Thank you so much.
We'll have more on some of those topics later in the show as we go in depth with Dr. Denise Karen Prochownik, this year's Outstanding Educator in Diabetes Award recipient. Now, though, let's go to Connecticut-based Silver Fern, a company providing a platform to help patients better understand and mitigate the behavioral and psychosocial barriers to personal diabetes care.
I was diagnosed a long time ago, and I think the future of diabetes care should focus more on whole person care and to integrate both the psychosocial dynamics as well as the nutritional dynamics as well as the physical dynamics. And I think a focus that combines those is very, very important for the future. And Silver Fern does that.
Epidemic chronic conditions are not medical problems, they are culture and lifestyle related problems. And so we need to kind of step back and understand the a profound change in the way we live. And so the whole healthcare system has to pivot and really look upstream and start thinking about how they can change the way we live and our environment. What we can do with this tool set is unlock the issues and then help the system to direct the patient to the people that they need and to the information and support services that they need in a very specific way. But we can work on this sort of large digital ecosystem, including there are a lot of digital health companies that can come into the healthcare organization and provide support and services that fold into it. So we start to have an ecosystem that's resonating where the Silver Fern unlocks data, we get patients the help they want, and we drive change.
The ADA Scientific Sessions features a wide range of session formats. Make sure to get to know them all and make the most of the content available to you at the meeting. Still to come, our interview with Dr. Denise Karen-Prochownik, where we look more at diabetes education and prevention, especially among young women. Now, though, to the first part of our look at the Insulit Corporation, a state-of-the-art insulin pump provider giving new options to patients around the world.
There are so many issues still there with diabetes, so that any way that we can support the individual with diabetes and the immediate family and caregivers to help manage all these tasks is so important.
Insulet was founded on the mission to improve the lives of people living with diabetes. And we do that through our flagship product, the Omnipod. Omnipod is a disposable, wearable, waterproof patch insulin pump, and it provides 3 days of nonstop insulin for people who need it. My own father wears the technology. So the fact that somebody who's been living with type 1 diabetes his entire life has been able to adopt the technology in his 60s or 70s, I think it speaks to how simple it is.
For me, the most challenging things about managing my diabetes before I moved on to Omnipod was the amount of injections I had to do. So I was doing between 7 to 10 injections a day. But not only that, I basically ran out of places to inject. The Omnipod kind of gave me the freedom of being able to use different sites, which has been a massive change for me and a really positive one.
Stand by for more from Insulet later in the show. But now to Australia, where diabetes Neuromatics are working on the first genuinely machine-intelligent artificial pancreas suitable for even the most unstable forms of type 1 diabetes. Let's hear from Carmot Therapeutics, Inc. now, a California-based clinical stage biotechnology company using a proprietary technology to accelerate drug discovery in diabetes.
Studies have shown that weight loss of 15% or more sustained over a 12-month period can reverse type 2 diabetes in more than 80% of patients. At Carmot, our goal is to develop drugs that provide 15 to 20% weight loss, in addition to insulin sensitization, in order to provide what is essentially a functional cure for type 2 diabetes.
The technology platform Chemotype Evolution is the foundation where we can introduce novelty and create breakthroughs to target challenging drug targets.
At Carmot, we built a portfolio of novel modulators of GLP-1 and GIP. These molecules are now in phase 1 and phase 2 clinical trials, both in broad as well as niche and orphan indications for type 2 diabetes and obesity.
This is an exciting time because now we have the opportunity to sit down with our patients to have a conversation about the real possibility to achieve diabetes remission.
Download the 81st Scientific Sessions mobile app and online planner now for everything you need to know about the meeting, featuring planning tools to build your own customized itinerary, access virtual meeting presentations, and engage with the meeting via social media. It's almost time for our exciting interview with Dr. Denise Karen-Prochalnik, Outstanding Educator in Diabetes Award recipient. But first, a little more from Insulit Corporation.
Insulit Corporation is the maker of the Omnipod insulin management system, and our mission is to help people with diabetes live better and healthier lives. How Insulet helps people living with diabetes is through our innovative technology, and now Omnipod 5 is our very first tubeless automated insulin delivery system.
Omnipod 5 is really, a game changer. It's all fully on body. It's a pump that we call the pod that sends your glucose values to the pod every 5 minutes, making insulin adjustments so that you think less about your diabetes.
What I want physicians and healthcare practitioners to know is that we really designed Omnipod 5 with the masses in mind to be able to bring the simplicity of Omnipod and combine it with world-class outcomes and clinical data to be able to improve outcomes and to be able to simplify life for people with diabetes.
Life is difficult enough. Diabetes does not need to be for our podders.
I'm now extremely pleased to be joined by this year's Outstanding Educator in Diabetes Award winner, Dr. Denise Karen-Prochalnik. Thank you so much for being here.
Thank you for having me.
You've been awarded for your work as a leader in preconception education and care for women with diabetes. What got you started in this area, and why is working with this population especially important?
I was working on a CDC grant with Bill Herman and Nancy Jans, and their question was, what factors predict women seeking preconception counseling? What we found was simple, that healthcare providers at one time told these women to seek preconception care in order to avoid complications during their pregnancies and to plan for their pregnancies. So with this opportunity now, that became my mission in life and my passion, and I wanted to develop a preconception counseling program for adolescent girls so we could start preconception counseling early and give it to them often.
Why is intervention with young people especially important, and what impact can this have on their outcomes?
Well, giving preconception counseling early, prior to sexual debut, women can then plan their pregnancy. So getting that information, raising awareness early on for both themselves and for a support network like their mothers really will help, hopefully, change their behavior and plan for their pregnancy.
Can you give us a brief preview of your talk? Why should people attend?
Hopefully this talk will give you some insight in how to present and prepare these women for a healthy pregnancy, how to prevent complications in the future. And it's not only women. We actually expanded it to ready guys as well. So it's also to help them to learn that trying to keep your blood sugars in the target range can help prevent complications with reproductive health. So hopefully you'll learn some of those messages with this program.
Again, congratulations on the award and best of luck for the future.
Thank you very much. And thank you for the honor of having this award. Thanks.
Wise words from a very worthy award winner. That's all from us today. Make sure, though, to click through for the full-length versions of all the content you've seen today and come back tomorrow for much more. You'll find us at the front page of the meeting platform, on the ADA website, and on YouTube and Twitter. Tomorrow, get Sunday's highlights with Dr. Dana Dabalea. Watch our interviews with Banting Medal recipient Dr. Jens Juhl-Holst and Kelly West Award recipient Dr. Nicholas Warham. And check out more features from around the world as we look at the very latest research into new drugs for diabetes. Don't miss it.